Hello, I'm Jan Leyfman, medical correspondent for OncLive, here on the floor of the 2024 CFS conference, day two. I'm joined with Dr. James Harding, a GI medical oncologist and early drug development specialist from Memorial Sloan Kettering Cancer Center. How are you today?
Great. It's been a lovely meeting, so thanks so much for having me.
And thank you for being here with us. So, your amazing session about GI oncology has just concluded. There was a lot to talk about, a lot of new advances. What is one takeaway for our audience that maybe you would like to speak about?
Yeah, I think with regard specifically to HCC, we're really seeing tremendous advances in the field. The last 5 years have been focusing on combination immunotherapies, and now we're seeing these come to earlier stages of disease. And some key aspects, I think, of the talk today was really its application as an adjuvant and an intermediate stage of HCC. So really an amazing time, many studies ongoing, but I think for me that was an important takeaway.
Awesome. Um, when you look at liquid tumors, and yesterday we had a whole day about that. There was just a lot of talk about immunotherapies and cell therapies really having a profound impact.
Yeah.
Now, when we look at solid tumors, that has not always been the case.
Yeah.
Where are we with these therapies in the arena of HCC
Sure.
and other GI malignancies?
Yeah. So I think, for specifically for HCC, I think we now recognize it's an immune sensitive tumor. That's for sure. And that's really been well validated now by innumerable studies in the advanced setting. And so we can use anti-PD-1 and L1 antibodies in the treatment of HCC. They elicit an immune response, tumors shrink. And with combinations, this leads to durable disease control. One that I would highlight would be the Himalaya study, which was durvalumab and tremelimumab, 5-year OS estimate of 20%, which is really unprecedented in the field. So I think this is the tip of the iceberg, so to speak, or the bottom of the mountain, whatever you want to call it. But we now know we can unlock an immune response. And so the field is moving to earliest stages of disease, and that's some of the things that I discussed today. But there's a number of new technologies that are coming into place, like bispecific antibodies, which are being tested right now in HCC, several cellular therapeutics, looking at various populations, particularly in HBV, as well as targeted therapies that are cellular in nature that have shown some very nice promising data. And I look forward to see that to continue to develop. So we're not yet at the stage of liquid tumors, that's true, but I think with the understanding that immunotherapy is of real critical importance at advanced stage, we now have a building block where we can, I think, go further.
Awesome. In your profound presentation, you spoke about taste. But as with some therapies, there are some limitations.
Sure.
Moving forward, how do you envision us further improving outcomes of patients undergoing this therapy?
Yeah, I think that's a great question. And so really the focus for regional therapies comes into like liver-limited HCC that's not necessarily a candidate for surgery or a liver transplantation. A common modality that is used is transarterial chemoembolization, or TACE. We know that this therapy can prolong life. It's used in a specific subset of HCC, not all liver-limited disease. But at the end of the day, the majority of patients do progress on it. And so the clinical question is, can we improve outcomes by bringing combination immunotherapy to earliest stages of disease? And there have been 2 studies now that have read out in this effect, Emerald 1, which looked at TACE versus durvalumab and bevacizumab in this intermediate stage, as well as LEAP 12, which evaluated TACE versus TACE, lenvatinib, and pembrolizumab. Both studies were well conducted, well designed. Both studies were positive for their primary endpoint of progression-free survival, immature for their overall survival data, but both indicating that a combined immune response may improve outcomes in this space. There are many other studies that are actually still ongoing, namely Emerald 3,
Hmm.
which is looking at other combinations, even triplets with a TACE.
Awesome. So, with the idea of looking toward the future, 2024 is almost over, and 2025 is around the corner. ASCO GI is around the corner as well. What study or studies are you most
Yeah.
looking forward to at that meeting?
Thank you. Yeah, so a GI ASCO, I think 2025 should be a great meeting. I am looking for continued early stage data, phase 1, 2 data that might be looking at bispecifics in HCC as well as continued look at cellular therapeutics. These are all early stage, nothing that would be practice changing, but certainly investigational. I'm excited and hope to see follow-up data for some of these pivotal studies, such as Emerald 1 and Leap 12 will be, I think, important to see.
Awesome. So thank you so much for your time, Dr. Harding. And for everyone at home, please stay tuned to Enclave for the latest updates and exclusive interviews from CFS 2024. Thank you.